Hey everybody, it's Monika and welcome to my channel where I provide resources and trainings to social workers, counselors, and helping professionals to deepen their level of self-awareness and to boost their competence and confidence in the profession. For today's video is going to be a mock CBT session around anxiety. So if you're interested in this video, then please keep watching. I'm Monika Thomas, the founder and clinical social worker at Kindred Connections Therapy Center. I've been a social worker for over 12 years. I decided to do an entire YouTube channel on my journey from cubicle working social worker to successful entrepreneur. Welcome to my channel. Hey Michaela, how are you?
Hey, I'm good. How are you?
I'm doing pretty good. How's things going at school?
It's different.
Yeah, we're going to get into it in a second. I'm going to set a timer for 45 minutes to make sure that we don't go over time. Okay.
Okay.
So tell me about it. What's so different now?
It, probably being in the bed for most of my classes and being on campus.
Yeah.
Like, usually you can schedule time to meet with your professor, like to go over the syllabus or something. And then now it's you have to do a whiteboard call, and then you'll be on the actual phone with them, and then you'll see them writing on the board on your computer.
Okay.
And that's different. And then being like separated from everyone and wearing the mask 24/7 is
Oh,
different.
yeah. And I'm thinking that might be the best of both worlds. You get to be in the bed and go to class. I thought that would
Yeah.
that might be fun. Okay. So, I just kind of wanted to start by doing a recap from some notes that I took from our last session. So, what we've been working on with you, do you know what we've been working on just to kind of make sure we're on the same page?
My anxiety.
Yeah. So we've been trying to make sure that we can really get a good handle
Yeah.
on when it's showing up, how it's showing up, meaning how intense is it when you notice it, and then where are you feeling it in your body. And then we really wanted to hone in on what your thinking is when that anxiety comes up, like what are those stories that you're telling to yourself, so we can start kind of working backwards so we know when it's showing up. So then we want to do some root cause work to look at, well, what beliefs do you possibly have around some of these negative thoughts that are coming up, and then we can start to deconstruct that a little bit more. But we're going to get into that later. But I
Mhm.
first just wanted to do an overview of kind of how your week has been.
Um, it's it's been up and down.
Okay, how so?
So starting like for my Monday, Wednesday, Friday courses, I haven't had them because there were like issues with Blackboard, so students were getting locked out and they couldn't log into their classes. And then because we're not in class, we don't know any of the people, so we're kind of like contacting people from like old club groups to kind of figure out what to do or how to fix issues,
Mm-hmm.
because you have to have appointments to go meet with like technology people or anybody. So
Mm-hmm.
it's like it's difficult to
Yeah.
do that being in your room.
Yeah.
And it's just been up and down for me.
Okay. So when if you noticed, because I know we talked about before, is working on a mood chart. And I were
Hmm.
you able to download the mood chart?
Yes, I transferred it to my planner.
Oh, good. Okay. So with the mood chart, we were really looking at times when you noticed that your anxiety was the worst, situations that occur when you noticed it. So when you started tracking on your mood chart, what did you notice?
I noticed I get anxious the most over things that I can't control.
Okay, that's good. That's
So
a good
if
observation.
there if it's something like yesterday, for
Mm.
instance, one of my professors emailed me and told me that I was enrolled in the wrong physics class, and then I needed to switch the class. So then I go to try to switch the class, and then I'm unable to do that because we've already started the classes.
Mhm.
And then I was worried that there was going to be a W on my transcript. And
Okay.
then I realized it was something that I couldn't fix because it was on a weekend. So it's like it's Wednesday. Then I was anxious, or I was like worried that I couldn't get out of the class, or I'll have to stay in this class and it doesn't count towards my degree. So my mind just started going through like all the bad when
Yeah.
I'm thinking, okay, I can't get out of this class, and then it may be too late to drop the class, and now I'm stuck. It won't count towards my degree, and I'll just be taking it for nothing. My mind went straight to the extreme instead of
Hmm.
just saying, just wait until Monday.
Right.
I noticed that.
Okay, good. That's a good observation. So, one of the things that's important to know when that comes up is not just your thinking process, noticing what you're thinking, but then also noticing the physical symptoms that come along with that. Because when
Hmm.
you're dealing with anxiety, not only is it dealing with how you're thinking, but it's also causing physical symptoms in your body. So, when you notice that anxiety comes up for you, where do you normally feel it?
So in the beginning, I kind of feel like in my chest. It's more
Okay.
like the breathing. Sometimes it gets faster, and
Mm.
then like sometimes it feels like I want to cry. But the biggest thing is in my chest.
Okay. What do you notice in your chest?
Sometimes it gets tight,
Mm-hmm.
or like kind of like if you're claustrophobic and you're like in a room, it kind of feels like I'm hyperventilating sometimes.
Yeah.
That's what
So
it
your
feels
breathing
like.
gets kind of shallow.
Yeah.
Okay. Do you notice any other physical symptoms in your body?
I do the leg thing, like
What leg thing? You tap your
I'll
leg?
tap sometimes,
Okay.
or sometimes I'll bite my nails. But the
Okay.
biggest thing would just be my chest.
Let me see your nails. You've been biting your nails?
No, not recently.
Oh,
I've
they
been
don't
doing
look
better.
bad. They not down to the meat.
No,
They don't look too bad. Okay.
no.
So you notice tightness in your chest. What about sweating? Do you notice any sweating?
No.
No? Okay. So the reason why it's going to be important for you to attune to those physical symptoms is because you can know when the anxiety is coming or when it's starting to ramp up. And then when you notice those physical symptoms, those will be the times when you want to catch it before it starts spiraling down into something that you can't control. So the more attuned that you get to noticing when your breathing is shallow, noticing when you feel that tightness in your chest, then you can go to your tools that we're creating for you so then you can use those things as soon as it comes. Now, that's
Mm-hmm.
not going to be effective all the time, but the goal is more often than not, you'll start to be more in control of it to where it doesn't feel like it's controlling your life and you find yourself overwhelmed over things that you can't control and ruminating and thinking to where those thoughts start to spiral down into something more negative. So the
Mm-hmm.
whole idea is to catch it before it becomes something, like I said, something that you can't control or that's unable to be managed. So I think that's good that you're recognizing how it's physically impacting you. And then you're also being able to pinpoint it to specific situations in your life. Is there anything else where you noticed that anxiety came up for you outside of trying to schedule your classes?
Um, I think far as like the virus being around people, I think
Okay.
like um when I was at home, most of the times I was in the house, or I never went out unless we went grocery shopping or something. So it's
Mm-hmm.
like now if I don't eat in my room, if I want to go to the cast, it's like there's 4,000 other people that's on campus, and there's
Yeah.
like a possibility that they were around someone who had it, or I know a girl, her dad actually died from it, and she's back on
Oh,
campus. So it's like
oh. So
she
that
was probably
exposure.
around. Yeah.
Okay.
And
How are you
then
managing that?
Um, I try to use a lot of hand sanitizer, or don't go out if I don't need to.
Yeah. And that's a real legitimate worry because people literally are dying from it every day.
Yeah.
And the bad thing about it is it's kind of no rhyme or reason to it. You really don't know who can recover from it or who is dying from it.
Mhm.
So I understand wanting to be extra cautious so you don't put yourself at risk, but yeah, it's hard to tell because you never really know.
So I think another thing is being on campus, you're still trying to finish getting your college experience. So not being able to do the things that you used to do, like going out with your friends
Yeah.
or going to eat, you don't really have that luxury.
Mm-hmm. Yeah. And I understand that because that's one of the main reasons you go to college is to have that college
Yeah.
experience, and then it kind of feels like it gets robbed from you.
And then we had, because we have incoming freshmen, so we've had a welcome week, and it's kind of like welcoming the freshmen, them getting to know like our SGA leaders and stuff like that. And we
Yeah.
did Bama State bingo. So you
Okay.
were allowed to go in like our little theater area, but you had to sit like two places from your friends, and then it was like two rows. So like every other row you weren't allowed to sit in. So it's like
Yeah.
usually the room is like packed. It's like 100 students, but now it's like 15 students could only be in it. So
Oh,
it's
yeah.
really different.
So it changes the whole dynamic of it. Yeah.
Yeah, then it's less fun because it's like
Yeah.
all the fun people, they're always late. So then they
Yeah.
don't get to come in. So then it's just boring and everybody's staring at each other. It's just odd.
Yeah. So that sounds like three main things that you brought up so far was noticing that the whole college experience has changed some, and then noticing that you kind of have to be worried about whether or not COVID can, whether or not it's something that you can contract or something that you can be diagnosed with. And then the scenario around you scheduling your classes. So those
Mm-hmm.
were the three areas that you noticed that the anxiety came up. Do you think in all three of those instances it stemmed from the same thing of that something that I can't control, like these things are outside of my control?
Yeah, because the scheduling my classes is out of my control. The virus is like you can only do so much with that because you
Yeah.
do still have to live life, and there's just that possibility when you leave your room or even sharing it with your suite mates or your roommates. There's still that possibility because they're going out or their parents are helping them move in or whatever the case may be. People are in and out of the building, so I
Hmm.
still think it stems from that not being able to control it, that worry that you can't like disinfect your roommates yourself or things
Yeah.
like that. So
Right, right. And then for that last one too, that the whole college experience. Now that one might be a little different though. That might be something that is within your control because even though, like you said, you can't control, well, all of those have some components that you can control. And I think that can be an important segue for us to think about um, the work that we can do moving forward. So let me see how much time we have really quick. Okay, we're still good on time. So let's think about this for a second. So right now we know that the anxiety for you comes up when there's situations where you feel like there's a loss of control or where there's something that you can't control. And then we've been able to identify three situations that have happened to you just within the week where you noticed that the anxiety came up because of that control reason.
mm-hmm.
So one of the things that I think can be important for us to do is you being able to think bigger about what it means to be in control of the things in your life. So for the things that you just mentioned, no, you might not be able to control um, when you can schedule for the class or the fact that you can't schedule on a Saturday or on the weekend. But if we think about those different scenarios, what I want you to start thinking about is what within those situations is within your scope of control. So with each of those situations, we know that there's things that are outside of your control that you can't do anything about, but equally within those situations, there are some things that you can control. So instead of worrying about those things that you can't control, what I want us to think about is what it would look like for you to focus more on those things that are within your control. Okay, so let's take the first example with you scheduling for the class. We knew you couldn't schedule on the weekend, but what is something, if you were to look at it maybe from a different perspective, you could feasibly say, this is something that I could do right now where I am with what I have. So if you were to ask yourself those questions, what do you think you will come up with in that first scenario?
So with that one, the first thing that I did was I called my aunt and she was saying, well, there's nothing you can do right now, but email the teacher that whose class you're trying to get into. So then I emailed my new professor and
Mm.
then she was saying, it's okay, you can wait until Monday. So that's kind of like how I fixed out and just
Good.
emailing that professor, the new professor, and then emailing the old professor and then saying, what can I do? And they were just saying, it's okay, wait until Monday. I'll sign the paper for you. Don't worry about it.
Yeah,
So I did that.
good. Okay, so that's a perfect example. And I think this could be a good note for you to make in your journal or your notebook. or even on your mood chart, is asking yourself those questions is, what can I do right now where I am with what I have? And then having that be a pattern of thinking that you integrate in when that worry comes. Now, again, that's another thing. It's not going to work all the time. None of these tools are going to work all the time, but it just helps to give you another tool in your toolbox when the anxiety starts to come. It feels like it's getting really heavy.
Okay.
Okay. Okay, so for the other situations, do you think that using that, what can I do right now where I am with what I have, do you think that could have been helpful in those other situations, the other two that we talked about?
Um, I to an extent,
Okay.
I think for like the college experience, like going to the bingo thing, that one was kind of like a risk I was taking to like have fun.
Mm-hmm.
So I think in my mind I would have to think of um ways of like protecting myself. So like what I would have would be hand sanitizer and a mask.
There
And
you
then
go.
that's probably about it.
Exactly. Yeah, and that's about all it can be sometimes. And you being more comfortable knowing that um there are going to be some elements of things that you can't control, but that doesn't mean that there aren't certain things that you can do to protect yourself. So even if you use that same 3 levels of thinking with as it relates to COVID, you can still think about, what can I do where I am right now with what I have right now. You can use your hand sanitizer, you can make sure you have your mask, you can make sure you do the social distancing. Those are the things that are within your control. Everything else that you can't control, then those are the things that we have to worry about, or we have to figure out how we can begin minimizing some of your worry around those things that are outside of your control. So,
Okay.
was it anything else this week outside of those 3 things that you think stuck out based off of what we talked about so far?
Um, not really.
No? Okay. So let's think about moving forward for the week. So one of the things that I want us to delve a little bit more deeply into, when I talked before about us deconstructing the negative thinking that you're having, um, around this idea of, I can't control it. So sometimes that can lead to a deeper level of thought. So I want us to take some time to explore that a little bit.
Okay.
And I want you to think back to, what is kind of like the earliest memory that you have of having that feeling or thought of, I need to be in control, or I have to control this?
Mm, maybe like living with my mom and then things with school. So like if education wasn't important to her, I know it was something that was important to me. So I want to go to college.
Mhm.
So if she was saying, "Oh, you don't have to go to school today," I figured that I needed to put myself in a position to where school is important and I need to go to school and I need to
Yeah,
make sure I have this and this done. So it'll
right.
probably be that.
Okay. So that's important because you it's important for you to know that these ideas and beliefs and thoughts that you have, they didn't just come from nowhere. They oftentimes
Mm-hmm.
stem from a much earlier belief that was reinforced over time. And then throughout you living your life, there have probably been things in your life that's reinforced this idea and thought that I have to be in control. And I'm sure that there might be a lot of other areas in your life where that has come into play. So this is a pattern of behavior, you feeling like you need to be in control. It's more of a protection thing. From what I'm hearing you say is, you maybe want to protect yourself from feeling like things are going to get um, to get in a position to where you can't figure out what the end goal is going to be, or you won't have control over the outcome, or it'll be something that you can't recover from. So it maybe is this idea that I have to make sure that I know what's coming ahead so I can prepare for it before something bad happens or before the bottom falls out.
Yeah,
Yeah.
I agree.
Yeah. So then if that's the case, that can absolutely create a lot of anxiety because, hey everybody, on this particular part, the video cut out. But what I was saying to Michaela was her thinking could absolutely create more anxiety because she's always anticipating for that negative thing that's going to happen, or she's creating a negative story around things that haven't happened yet. So one of the questions that I think we need to ask is, what would it look like if you were able to relinquish some of that control? So if you were, I know it's kind of like a big deal, even just the thought of it can sometimes create a lot of anxiety. What do you think your life would look like or could look like if you made the decision to not think about the end goal or the outcome, but just to kind of let things go with the flow? How do you think your life would be?
I think my first thought is I would be like a wreck, only
Okay.
because I like to plan. Like I use my planner for everything, and I feel like if it doesn't fit within the planner or meet the standards to go in the planner,
Mm-hmm.
it's not gonna work. So I feel like
Okay.
if I was to like just throw the planner away, I think without thinking about like the bad that could happen, I think things will go smoothly. I
Okay.
think if I would not worry about like the things I can't control, or if I didn't worry about the stuff that I don't even know about yet, like if I worry about the future stuff. If I
Yeah,
like stayed in the present, I think I would be better, or
that's
it would be
perfect.
easier to live if I didn't have those worries.
That's good. And that's one of the telltale signs when you notice that anxiety is present, because I often tell people anxiety is one of those emotions that keeps you thinking too far back into the past or too far ahead into the future, and it robs you of being present because
Yeah.
you're always thinking about things that you didn't do or things you could have done or things that you wish that you did differently, or you're always projecting forward thinking about what's about to happen, or is this going to work out, or what if this doesn't happen, then I have to do that. So you're either too far back in the past, too far ahead in the future, and then you can't enjoy the things that are happening for you right now. So with you thinking about what would it look like for you to just be present in the moment, that's not saying that you can't plan. I think that's important for us to note that planning is absolutely a part of what it would take for you to reach your goals, because that's what you're doing now. Being in college, you have a goal that you're
Mm-hmm.
trying to reach because your goal is to be a doctor, right?
Yes.
Okay, so we know that you have that end goal in mind, but the purpose of it is not to not plan, but the focus of what we're talking about is more so about being in alignment with those things that as you're planning, that again are within your area of influence, that are within your scope of focus, things that you have control over versus the things that you don't. And when I get people thinking about, well, what's the difference between what I can control and what I can't? You have to know that the things that you can control are your thoughts, your feelings, your emotions, your reactions. The things that you can't control are other people's thoughts, feelings, behaviors, and reactions. So whenever you notice yourself thinking about, oh, did they use their hand sanitizer, or did they wash their hands, or the professor didn't email me back, all of those things are outside of your control. And the things that are within your control are the things that have to do with you, what you do, how you think, and how you feel. So that's a good way to try to balance and remember the difference between those two. Okay.
Mm-hmm.
Okay. So what I think we can do now is um, thinking more about the areas that are outside of your control and that issue of needing to control. So I still want us to go a little bit more into what would that look like if you were to relinquish that control. So right now you said it would feel chaotic, like you couldn't plan. Um,
Mm-hmm.
but let's say, for example, if you still could plan, what do you think that would look like? So it's not totally chaotic. You still have a planner. So how do you think
Um,
that would look?
I can relate it to the class things we talked about earlier, like how I couldn't register for the class. So I think what that would look like is kind of like going back to the doing what I have control over. So
Mm-hmm.
that would be instead of trying to plan all the way, like you're not going to be able to get out of this class, I can look at what can you do now. So that's waiting until Monday, or just kind of focusing on, I don't know, that's where it gets gray.
How
Because
so?
I think because I am a planner, I
Yeah.
try to think so far into the future. So
Mm.
I think that's the part that I struggle with as far as like managing the anxiety part.
Yeah. Well, I think the part of it is not so much the planning for you. I don't know that that's what the issue is. I think what I'm hearing from you is the issue is what if it doesn't work out? It's always
Yeah.
that the negative tone to it. It's not like, oh, I'm planning knowing that I'm going to make it to my goals. It's like, well, what if I don't? Or what if, what if I don't get into the class? It's always this element of fear that I'm hearing that comes up where maybe that's leading your planning. So what do you think about that? Does that sound like it could possibly be true that maybe it's not the planning that is the issue, but maybe it's the fear of not reaching your goals or the fear of what if it doesn't happen that really creates the anxiety?
Yeah. But
Okay.
I think no matter what I do, I think that's always in the back of my head. So
Mhm.
like I can probably say I've probably thought about what if I can't get into this class on Monday like 12 times, like the whole entire day. So I feel like that's probably my biggest issue.
Right. It's always worst case scenario.
Yeah.
Okay. So then that can go back to that imaginative kind of visionary thinking that we were talking about before is what would it look like if you didn't think worst case scenario? What kind of
Then I
things
still
would you say
think
to yourself?
you're gonna get into this class on Monday. It's gonna be fine.
Well,
Don't
you
worry
could
about
say
it.
that, but then if that didn't happen, you would be disappointed.
I would. And I think
Yeah.
that's why I think about the negative so much because it's like if I'm already prepared for the negative, I can't be disappointed because I already knew that this wasn't going to happen. Or even I'll
Mm,
still be upset, but like in my head, I'll be like, you knew that, Michaela. You knew it wasn't going to happen.
yeah. So you like to prepare for the worst so you don't have to deal with the disappointment.
Pretty much.
Okay. So I think that's important, an important thought. I want us to put a pin in that because we can go a lot deeper than what we have time to today. But let's write that down. Not wanting to deal with the disappointment. And then when we have more time to get a little bit deeper into that, we can explore a little bit what that might stem from and how we can get to the root cause of that feeling
Okay.
feeling disappointed. Um, but I think with that, with the worst case scenario thinking, um, one of the things that I always wonder or like to get people thinking about is if you can think worst case scenario, what would it look like for you um, to create a scenario where things actually did work out for you? If you practice on saying those things to yourself, do you think if you did that, it would be too unrealistic?
Sometimes.
Okay. Yeah. And it
I
can
think,
feel like that.
yeah, especially being in college, I think that's sometimes unrealistic because there's a lot of times I've walked into a test like I'm gonna do great. I got an
Yeah.
A, and then my grade is not so good.
Exactly. Yeah. So then I think what we need to begin thinking about is how we can have a balance of that. Because it sounds like you want to be realistic from what I'm hearing you say, you want to be realistic around the fact that disappointment is going to come. So you don't want to set your stakes up or your standards up too high because you know things might not work out. Um, but then you still have some elements where you're planning so it can. So you're doing both, but it sounds like the fear is what's driving you the most is that fear of failure or fear of losing control. So what I would want us to think about doing is how can we integrate a more realistic um, idea of what can happen in your life as opposed to it going to the default of the worst case scenario or that bad thing that can happen. So let's say, for example, if you didn't think, oh, I'm going to ace this test, or I know I'm going to get, I know I'm going to do a good job on it, and I know that I'm going to pass this class, because that might not be realistic. So one of the things that I think could be helpful for us to think about doing is not maybe doing the big extravagant, I know this is going to work out perfectly, but maybe just some affirmations and some proof that you can give to yourself to reaffirm what you already know. So for example, you might not know that you're going to pass the class, but what you do know is that you spent 5 hours studying, or what you do know is that you went to 2 study tables last week. So we have to look for some evidence of things that we know that you did that can affirm that belief. So it's not kind of like pie in the sky, unrealistic, but we have proof of actions that you've done to reaffirm those ideas. So let's say, for example, if we were to use you passing the class, what do you think could be some realistic ideas that we could say, or you could say to yourself, not saying I'm going to get an A, I know I'm going to pass, but something that you think you could give yourself evidence based off some actions that you've taken?
I asked questions when I was confused.
Good.
I studied and read my chapters when I needed to. I completed all my assignments on time.
Good.
And I did what I could.
Absolutely. See, that's a more realistic idea to tell yourself, not that I'm going to pass the class, but I did the best I could. I set aside time to make sure that I understood the information as best as I knew how. So with that, I think that would be more realistic. If you told yourself those things, reinforce the evidence of the things that you've done, as opposed to creating an expectation around something that you want to happen that maybe you've not even done the work for, or the proof isn't there. Does that make sense?
Mm-hmm.
Okay, so let's look at the time to see how we're doing. Okay, we still have a couple more minutes. Is there anything else, any thoughts or reflections that you have on what we discussed so far?
I think I really want to try the words of affirmation, because I
Okay.
think that would help with like the daily stuff, like the stuff that I can't control. I think that would really work with that, since it seems like I have a control problem,
Yeah.
and I think
Yeah.
my anxiety comes from control. I
Yeah.
think I want to try that for sure. And maybe when I do my mood tracker, whatever is making me anxious, that's what I could put down. So if it was not being able to get into the class, if I email my professors and I've already been approved to move to the class, just get the papers so I can go to the class. I think that's what I
Yeah.
want to do.
Yeah. Yeah, I think that's good. I think that goes back to the doing what you can where you are with what you have. In
Mm-hmm.
those situations, I think that could totally be helpful for you. And be mindful when that anxiety comes up, and try to do that process of, I'm just going to do what I can where I am with what I have. Try to get that to be as automatic as the negative thoughts are automatic.
Okay.
But it's going to cause you to be really intentional about your thinking before it starts to spiral down into something more negative. Because what that can spiral into, I always tell people, anxiety and depression are distant cousins. So what that means is your anxiety can start by, oh, I got to get in this class, I got to get registered, let me figure out how I can get in. If I don't get in, then I'm not going to pass. If I'm not going to pass, then I'm not going to be able to graduate on time. And then it just starts going down a slippery slope. So once you're in that ruminating, negative thinking, and your thoughts are going really fast and you're worrying, what that can spiral into is sadness and depression. Then you start getting down on yourself and saying, Michaela, you never do anything right. You always mess stuff up. And every time it comes, when you're trying to plan something out, you always figure out a way to get it wrong. How come you just can't do this? Or how come you just can't plan earlier or do more? So then once you start spiraling into that negative thinking, then that's when the sadness and the depression comes. But it didn't start as sadness and depression. It started as worry, ruminating, concern, and fear. But now it's gone down to something that's, making you feel sad, not wanting to get out of bed. And then it's causing you not to be able to show up for your classes or show up for yourself. So you want to catch that anxiety before it begins to spiral down into more depressive and negative thinking. Okay. So we talked about a couple things today. So let's talk about moving forward for the week. I want us to talk about what that would look like for you managing the anxiety moving forward. So one, I think it's great that we've kind of identified and pinpointed when it comes up. So we know that it's in situations that you feel like you can't control. So with that, for this week, one of the things that I want you to attune to and be more particular about being mindful of is things that are within your control and things that are outside of your control. Do you remember what we said is the difference between the two?
Mhm.
Okay. What do we say?
So we said the things that are in my control is my thinking, how I react, and then what I do. And then what's out of my control is other people's thinking, how they react, and what they do.
Absolutely. Yep. Their feelings, thoughts, things that are outside of your control. Good. So you want to be mindful. You want to be able to put those things in those two buckets. When something comes up, is this within my control or is this outside of my control? And then once you've identified that, you ask yourself that question, is this within my control or is this outside of my control? Then two can be the second thing that we talked about. So if this is inside of my control, what can I do where I am with what I have? What can I do right now with where I am with what I have? And then you could go through that process and then start to think about what would that look like for you. So the things that are outside of your control, I think it's important for us to talk about that too, because those things are still going to create worry. Even though it's outside of your control, that's not going to keep you from worrying about it. So what do you think could be a solution or something that you think we could work toward for this week that can help with those things that are outside of your control?
Um, could I do the list for that too?
Do a list.
Like what I can't control? I'm not sure how that will look.
Okay. Well, I think we can think about it some more. So I have a couple ideas on what that could look like. We won't have time to go into it today, but I have some strategies that we can use when it comes to dealing with the things that are outside of your control. I'm gonna just mention it briefly, but we can talk about it later. So one of the things is if you can't control it, one of the things that we can think about is if you can't control it, can you influence it? What things can you do to help influence someone else's actions, behaviors, and thoughts? So we can get more into thinking what that will look like. And then if you can't influence it, then we can talk about, what do you do then? So that could be something we can discuss for next session. Okay. So we have those two things that I think could be helpful for you to work on. And then the thing that I put the pen in for us to work on later is not wanting to deal with the disappointment, and that being the reason why that control can be showing up, or why you might be so adamant about making sure everything is so particular in this way. And then maybe what are some of those feelings and thoughts that could be underlying that disappointment that's driving your behaviors. So we can talk about that too when we have a little bit more time.
Okay.
Okay. So any thoughts or takeaways before we wrap up? Is there anything outside of the action plan that you think will be helpful for you this week? Or what do you think will be most helpful?
Definitely the words of affirmation.
Okay. How so? Tell me how you will plan on using that this week.
I think I need to do what I've already done and what I can do. I
Yeah.
think that's going to help instead of me going straight to the negative. I think that will help me stay in the present.
Yeah, that's good. So those affirmations, you reaffirming to yourself, okay, Michaela, you've already done this, you've already done that, you did this, you've prepared this way, you've taken these notes, you've called this person. So you reminding yourself of the things that you've currently done in the present moment to work towards your goals.
Mm-hmm.
Yeah, I think that's good. So the affirmations, anything else that you think will be helpful? Any other takeaways?
Um, I think the pinpointing helps too, like realizing, like we talked about a few minutes ago, the body language thing. So like feeling when my chest is tight, I should realize I'm getting anxious and I need
Yeah.
to breathe. Or I think that's a big thing too.
That's good. And we didn't even talk about breathing, but yeah, that's really important. That's very crucial because you mentioned about your breathing being shallow. And then when your
Mm-hmm.
breathing becomes shallow, it really impacts your ability to think long term and your ability to make decisions. So I think that would be really good because what breathing does, it brings you back to center and it gets you more in tune with your senses. So when your breathing is really shallow, you might notice that your thinking is kind of very sporadic all over the place. It might be like, well, I
Yeah.
gotta do this, and I gotta do that, then this, then this. So it's very condensed, very short. But when you breathe, you begin to take in more oxygen. You kind of bring yourself back to center. You notice more about your breathing. You attune to your breathing. So it doesn't keep you ruminating in your head, but you begin focusing on your breath. So breathing is very crucial when you notice that anxiety is starting to heighten. And then with your breathing, you could do some of those other techniques that we talked about, the affirmations. You can be breathing while you're doing those affirmations. Or you can be breathing while you're asking yourself, what can I do right now where I am with what I have? And then just kind of bringing yourself back calm and back to center. So yeah, I think that's a very important one.
So I think I'm going to work on those.
Okay. Yeah, that sounds good. Anything else before we wrap up?
No.
Okay. Well, I hope you have a good rest of your week. We can meet the same time next week. Does that work for you, or do you have to check your school schedule, or think the same time will work?
No, this is fine.
Okay, good. If anything changes, just call me or let me know, or send me an email, and then we can reschedule. But I'll just look forward to seeing you next week at the same time. And then if you need anything from now to the next session, you can always reach out as well.
Okay.
All right. Well, have a good week.
You too.
Okay. Hey everybody, if you like this video, please like, subscribe, or share it. Also, be sure to click the notification bell because I upload a new video every Monday. And make sure you check out the Afrocentric Social Worker podcast. You can check that out on all the major podcasting platforms. The link to the podcast can be found below in the description.